We're going to still talk about the awareness you need to grow now about preparing for birth. If you're 24 weeks pregnant now and the due date is at 40 weeks, 80% of women give birth 2 weeks either side, and that's if they go into labor and have a vaginal birth. In fact, instead of being 16 weeks, it could be 14 weeks, or it could be 18 weeks. But let's first talk about your awareness about this thing called birth and pregnancy. There are 3 types of births. Woman labors, and then she has a vaginal birth. That can be at home or in the hospital or birth center. It can be without much medical care or a lot of medical care. From Birthing Better Family viewpoint, that doesn't matter. Or a woman can labor and end up with a surgical delivery or surgical birth of the baby. The birth could start at home or a birth center and transfer, or it could start in the hospital and end up with a cesarean. The 3rd type of birth is a non-laboring cesarean. That means you schedule a day when you go in and drive to the hospital, the woman is prepped, and then she has surgery. Mostly, you are permitted to be with her. The 4th type of birth actually is a vaginal birth after a cesarean. For women who have had cesareans, some of them would like to have a vaginal birth. We've named it wrong. In order to get to the good part of the vaginal part, you have to have done the hard work of labor. So when you're aware of yourself, we want you to understand this important fact. The mind knows that there's going to be a non-laboring cesarean. The mind does not know there's going to be an unplanned one. The body and mind are preparing to labor and have a vaginal birth. That's what the body's doing. So even if you're going to have a non-laboring cesarean, your baby's mother's body is preparing to labor and have a vaginal birth. That means all of the hormones and the changes in her body, her mind, and her emotions and psychology are the same as a woman who ends up laboring and having a vaginal birth. And this is the good news, because we can all prepare the pregnant body in the same way. So you need to be aware of these facts. And once you're aware of these facts, then you can learn the appropriate skills to help your partner prepare her body to do this unknown birth that will unfold.